Assalamu alaikum viewers. Welcome to YouTube channel Study with Kamran. Dear viewers, today we will discuss a new episode of video lecture about respiratory physiology. In this lecture, we will discuss the factors which affect the airflow to the alveoli. Since gas exchange occurs at alveolar level, we have to consider lung compliance, second, the elastic behavior of lungs, and the third one, airways resistance. In this video lecture, we will discuss the first two factors, that is lung compliance and elastic behavior of lungs. In the next video lecture, we will talk about airways resistance. Now we consider the lung compliance. When chest expands during inspiration, the diaphragm descends down and the rib cage becomes elevated. The decrease in pleural pressure in intrapleural space lead to the lung expansion. Representing a change in lung volume means the lung volume is increased. Adequate ventilation depends on how easily the lungs can expand, that is, easily inflate or distensible with minimal effort, as most of the breathing work goes into overcoming the resistance of elastic lungs and thoracic cage to stretching. Clinically, the ability of the lungs to expand or stretch is called compliance. It is defined as lung compliance is the measure of the extent to which the lung will expand, that is change in volume of the lung, for each unit increase in the transpulmonary pressure. Mathematically, compliance is defined as the change in lung volume divided by the change in transpulmonary pressure. Means that there is more inflation with a small change in pressure. A high compliance lung stretches easily as compared to low compliance lung, which needs more input from the inspiratory muscles. On the other hand, expiration is a On the other hand, expiration is a passive process and depends upon the elastic recoil of the lungs. That is the ability to return to their original configuration. So compliance is different from elastance, that is elasticity to recoil back. If a lung stretches easily, it does not mean that it returns to its original or resting volume when stretching force is released. That is elastance. A decrease in compliance, lung compliance means a stiff lung which needs more work to be done to stretch it for ventilation. Pathological conditions in which compliance is reduced are called restrictive lung diseases. Two common causes of decreased lung compliance are inelastic scar tissue formed in fibrotic lung disease and inadequate alveolar production of surfactants. Both conditions lead to stiff lung. Now we will discuss the second factor, that is elastic behavior of lungs. Elastic behavior of lungs means their ability to recoil back or deflate during expiration once they become inflate or distensible. They go back to normal situation. During inspiration, this behavior is determined, this recoil back behavior of lungs is determined by two factors, that is the elastic connective tissues present in the lung and alveolar surface tension. Elastic connective tissue. The elastic connective tissue consists of elastin and collagen fibers found in lung parenchyma. That is, these elastic tissues are present in alveolar walls and around blood vessels and bronchi. On stretching the lungs in inspiration, they become distorted and have tendency to recoil back. However, due to the interwoven mesh-like arrangements of these fibers, the lung remain compliant and readily distensible. Now, second behavior, the connective tissue, and second is alveolar surface tension. We know that lung parenchyma is comprised of alveoli. Alveoli are thin-walled, small ball-like structures lined with fluid, that is water molecules, and filled with air. So the force of surface tension exists at water molecules at the water-air interface. These lined water molecules in alveoli attract each other as a result of stronger cohesive forces among like molecules than the adhesive forces between water and air molecules. The resultant force effectively creates an inward pull on the surface of each alveolus, resulting in the escape of air within its cavity and causes the alveolus as small as possible. Because the alveoli of the lungs are highly elastic, they don't resist surface tension on their own, which allows the force of surface tension to deflate the alveoli as air is forced to move out during exhalation by the contraction of the pleural cavity. The inward pull is called collapsing pressure and is determined by the law of Laplace, is called which is equal to what? Collapsing pressure is equal to 2 surface tension over R. St represents surface tension and R represents the radius of the alveoli. Due to this pressure, alveoli are inherently unstable. Surface tension also resists the expansion of the alveoli, thus decreasing the compliance of the lungs. These alveoli they become shrunken, and due to this surface tension there is difficulty in expansion of the alveolus, and hence it affects the compliance. Furthermore, if two alveoli of different sizes have the same surface tension, the smaller alveolus has a greater collapsing power and would tend to empty into the larger alveolus. As a result, the air within the smaller alveolus, that is higher pressure, flows into the larger ones, that is the lower pressure, and an area of atelectasis. Atelectase, that is airway collapse, develops. Here, if this smaller alveoli become collapsed, due to what the air from this smaller alveoli moves into the larger alveoli, and this smaller alveoli becomes collapsed. The force of surface tension in lungs is high enough to cause airway collapse after exhalation, making reinflation during inhalation much more difficult and less effective. However, this high surface tension in the alveoli is reduced by the production of surfactant by type 2 alveolar cells of normal lungs, and lungs inflate and deflate in normal fashion during breathing process. Uh, Means the alveolus type 2 cells, they release surfactant, and these surfactant play important role. The surfactant is dipalmitoyl phosphatidyl choline, which disrupts the cohesive forces between the water molecules and performs three functions. Number one, decrease surface tension. Number two, increase alveolar stability. And number 3, prevents transudation of fluids. Excessive surface tension would tend to reduce the hydrostatic pressure in the tissue outside the capillaries, resulting in increase in capillary filtration. This results in interstitial edema formation and excess fluid in the alveoli. Uh, in case of the developing embryo, uh, as fetus grows and develops in the womb, it receives oxygen from the mother's blood via the placenta. So his lung do not start functioning until 28th week, when surfactant production in type 2 cells of the alveoli is started. Hence, preterm neonates require more care, otherwise their lung have more tendency to collapse. This alveolar surface tension what reduces what to the reduces the alveolar surface tension causes reduction of the alveolar size and contributes to the elastic behavior of lungs. In the next video lecture, we will discuss airways resistance. Thank you. Allah Hafiz.
Tell me pretty lies, look me in the face. Tell me that you love me, even if it's